All right, I'm going to be conscious of your time, so we'll get started, and I'll keep letting people in as they come in. But thank you for joining our next Denkmeyer educational series lunch and learn session. This one's we're just going to be talking about shoes today. So I want to review just a few topics: the importance of shoe choice, tips for picking shoes, traditional shoe options, and some adaptive shoe options. And then shoe modifications. So why shoe choice is important. We know that shoes are tough, especially a lot of you that I recognize the names and physical therapists. And so shoes for a lot of people are fashion. So there's a look to it, there's a style to it. It's not always the function that we are trying to get from our patients. And so there is some mindset or behavior change that we're going to have to keep in mind as we work with our patients who do want to improve. They do want to be able to improve their gait, for instance, but they also tend to have, or many of them tend to have some strong opinions on their shoe choice and how that affects what they are willing to put up with. In terms of devices as well. So it's a whole package for sure. We as orthotists and prosthetists really think of the shoe as part of the whole functional unit. The devices are typically not designed to be used without shoes. Now they can be, but again, the point of and the alignment of the devices are for the most part done with the shoe in mind. So we wanted that whole package. For orthoses in particular, the device relies on the shoe to be able to contain and provide additional levels of control. And for our prostheses, it provides the right alignment so that they can maximize the function of the foot and or knee or other components. So when we're looking at shoes, what we want to see first is just thinking about the appropriate heel height. So most of our devices are aligned to about a 3/8 inch heel height. And what that is, that's the difference between the height of the sole at the heel minus the height of the sole at the forefoot. So that angle is what we're really talking about here, which is typical for an adult tennis shoe. We may align it a little differently for kids, which tend to be about a 1/4 inch heel height differential. And also just in general, the contours of the shoe with that heel height too. So you can imagine that if someone was in this first shoe on the top left, everything would be pitched more forward than if they were in the appropriate shoe for what it was aligned for. And the opposite would be true for the bottom left shoe. So everything might be pitched more posteriorly. Hey everyone, sorry about that. Zoom just kicked me out, so that was a little odd. But I'm back. And so where we were, looking at the bottom shoes, you can see as well the contour is on that bottom left is mostly flat. And for instance, our prostheses in particular have heel heights built into the foot itself. So it's just not going to sit as nicely in a flatter shoe than it is in one that actually has a matching heel height contour. Another thing we want to look for in our shoes, and this would be particularly for our orthoses, is removable insoles. For those who have worked with a lot of orthoses, you know that that removable insole can make the world of a difference, just taking that out to give the patient more room in the shoe to be able to fit the orthosis. especially if they do have extra depth, you can modify too if you want to put an extra one into the contralateral shoe. But really, and especially if they're bilateral, just giving them that extra room for their foot to be contained well in the shoe without being overcrowded. That removable insole can play a big role there. Oh, I guess I'm not sharing my screen. Thank you. I think when it kicked me out, I lost that too. Thank you for pointing that out. Can you all see my screen now? Good. Okay. We also want to talk about the structure of the shoe, and a firm heel counter is going to be able to actually give us the support as well as the structure required to contain the orthosis or prosthesis well. With a firm counter, what we'll see often in that first picture is, especially as people are, if you don the orthosis first and then put it in the shoe, that first one you'll find that a lot of shoes kind of get packed down at the heel. And we really want to avoid that because we're not getting that containment anymore. We're not getting the appropriate support. If we have a firm heel counter to begin with, that could actually assist the patient with donning the orthosis into the shoe and prosthesis as well. We're also looking at adjustable openings and closures. So it's going to be much easier for your patients if they have a wide opening at the toe to be able to get into the device and then be able to close it and cinch it properly. So in general, slip-on shoes are not as good, but we'll see one that does have some adjustability to it when we talk about shoe choices. But in general, ones that open up, you can get your foot in, whether that's a prosthetic foot or your anatomical foot with an orthosis, and then be able to close it back down. And oftentimes too with orthoses, with prostheses, we do want to keep the same shoe size as they typically would use for their contralateral side. But for orthoses, we often want to size up either a half size or one size larger. Larger than that tends to be a little too bulky for the patient and makes gait difficult. There are options with certain places you can purchase shoes to be able to get these different sizes, especially if it is a unilateral patient. So Zappos, for instance, will sell you a single shoe in one size and a different shoe in the other. Nordstrom's does that as well, but it has to be a size and a half greater difference. So, but Zappos is very friendly with the sizing differences. So some traditional shoe options that work really well with our orthoses and prostheses are our diabetic and casual shoes. So the Anodyne and Dr. Comfort are often recommended from the physicians that we work with for our patients, especially if they do have diabetes and have a contralateral side that requires some additional protection. Both of these kinds, the Anodyne gives you lots of different options, and Dr. Comfort is a really nice, just simple orthopedic shoe. All of these are pretty lightweight and easy for the patients to get in and get out of. Additionally, if you want some with a little bit more structure, the Rockports and the OrthoFeet are also often recommended. And these will give you, again, just a nice casual shoe that has a removable insole and good support, a really nice solid base to be able to provide that additional stability. We often get asked about athletic and walking shoes. So the Hoka's and New Balance has nice wide widths. So especially in that toe box, New Balance tends to be really accommodating for that. And then the Asics Brooks and Saucony, they are all additionally highly recommended from our referring physicians oftentimes to be able to provide that kind of support, but lightweight structure for our more active patients. In terms of running shoes, you may or may not realize that there are 3 classifications for running shoes. So we've got our neutral or shock absorbing shoes. These tend to be for our more supinated or rigid feet, or just our neutral feet that we're not doing a lot of medial lateral control for. The stability shoes are good for our mild pronators. And then the motion control shoes are good for your moderate to severe pronators. And the shoes in general will be labeled with these different categories so that you can, if you are going to a store, particularly like a running shoe store or something like Van Dyke and Bacon around here, they would be able to show you what classification that particular shoe is. And it has to do with kind of stability that's built into the shoe or the cushion that's built into the shoe. So your stability and your motion control shoes will have more medial control, medial support to resist that hyperpronation. Some adaptive shoe options. So these are newer ones on the market. You may or may not be aware of these, but they do provide some greater accommodations, especially for our patients that have a difficult time with shoes. Billy Footwear is really popular among many of our patients. And the nice thing about these is that they have this zipper opening that goes all the way from the ankle down and around the forefoot. And it gives this nice wide opening so that the patient can put their entire foot in and just sit it in. They don't have to like try to shove their foot into the shoe. They just lay it right into the shoe and then can zip it back up. And it does have ties too, so you can tighten it or loosen it. But what most of our patients do is they tie it to a certain amount once we fit the orthosis into it, and then they'll just zip it on or off. It's easy enough to do one-handed as well. So for our patients, for our CVA patients who may have difficulty with their hand, their upper extremities, this is a nice option as well. They do come in adult and pediatric sizes, and while the Billies typically are high top, they do have some low top options too. So nice containment, good support, a nice stable base in that wide opening, which is so nice. You can find them at Target. Also, Zappos has them. Again, if you're looking for different sizing, that's a nice option there. And billyfootwear.com will show you all of their options for what they have. They have a wide variety of styles available. Kizik shoes. These are nice for patients who really want just a hands-free donning. Now some of them they do still have some adjustability with the laces. Some of them are purely slip-on, but they all have this reinforced heel counter, which is meant to be done so that you don't unlace and lace back up, because the heel counter will kind of it will hold, and if it does squish, it rebounds really well. Typically, you can find them at kizik.com. I was not able to find them on Zappos, but there may be some other places you can find these too. Nike came out with the Flyease, which are really cool. So this is meant to be specifically for help with patients who need donning assistance. So the idea here is that the whole posterior has this hinge that will twist away from the rest of the shoe, and so that you can don it really easily, almost like a clog, just sliding in from the back. But then the heel will pop back up. You just push your heel down to the ground, and that whole heel counter will pop back up and is held securely onto the back of the foot. So you have that stability with the ease of donning. They used to be sold on Zappos, but they are currently only found on Nike and some other smaller sites as well. And so those are our favorite adaptive shoes. And I'd be curious to hear if anybody else has any other ones that they use frequently. But I want to talk a little bit about shoe modifications. So there are some other things that can be done to shoes, existing shoes, to adjust them further to be able to achieve the kind of functional benefits that you're looking for. So one would be to add more of a cushion heel. This would allow some effective plantar flexion at heel strike, so it reduces a knee flexion moment at heel strike. So if you have someone with too hard of a heel and they just kind of go forward and you have that rapid rapid foot flat and rapid knee flexion, this can reduce that. A metatarsal bar is effective if you're trying to change what the toe break is on the shoe, and you can move it a little bit more posterior. So if they do have forefoot issues that you're trying to offload or avoid, adding metatarsal bar can be helpful there. We will do extended steel shanks if we actually want to move the toe break anterior. And we'll do that sometimes, especially if we're doing like metal orthosis, a metal AFO. And we want to make sure that the shoe isn't breaking too early and putting too much pressure on the midfoot. So we'll extend it out so that they get the full functional benefit of the AFO. Lifts are done if we are adjusting for a leg length discrepancy. It can also be done if they have a contralateral swing phase deviation, and if the lift is smaller than a ½ inch, typically we will do this inside of the shoe, but a ½ inch or greater we can do externally to the shoe. There are angular changes that can be made, so some wedging. You can do a sagittal wedge. So think about your patients with the plantar flexion contractures, where we want to move the floor up to their heel and give them that full foot flat contact during weight bearing. We can also do coronal plane wedging, so medial lateral. This can be done at the heel only or from the heel all the way to the toe. Again, your inverters or your everters that need a lot more support in that, or maybe the orthosis itself is not enough to accommodate. And either of these can be done, the coronal plane ones can be done essentially either as trying to elicit a functional change or accommodating for a fixed position. Flares are an adjustment to the heel to widen the heel. You can do it medially and or laterally. So obviously you can see in this picture, we've got both medial and lateral. That just gives you a nice wide, stable base. But you can do one or the other. So if you have someone who's a supinator, you would do it on the lateral side. If you have someone who's an excessive pronator, you could do a flare on the medial side, especially if they tend to roll over that side of the shoe. And then a rocker sole. This is done if we are locking out their ankle for some reason. So it could be done because their ankle is anatomically locked out from a triple orthosis, or we are locking it out with a solid ankle design. But we want to really help them achieve the typical 3 rockers concept of the gait with the heel rocker, the midfoot rocker, and the foot rocker. So that they have that smooth rollover during stance. So additional material can be added, and that rocker can be adjusted so you can change where the apex is at the heel and at the forefoot to change where they actually where they roll over of the shoe. So I'm just going to stop there. I'm curious if any of you have additional shoe choices that you really like to use for your orthotic or your prosthetic patients. Feel free to pop them in the chat. If there's anything that you want to comment to this group about things that have worked well for you or not worked well for you, I'd be happy to share that at this time too. Hey, Mark.
Hey. Thanks, Angie. Just wanted to say we've been using the anodyne shoes in a study at Hopkins with a diabetic foot clinic. And they're really a good option in many cases because they're super device friendly. They have extra depth, they have a firm counter, they have all those features that you're looking for in a shoe, reasonable heel to toe differential. And we've been able to get them provided through some local pharmacies under insurance coverage. So that's really a nice option too. If we can refer them out and get well-fitted shoes and know that they're the right size and they're covered, patients I think are more likely to accept them if they're paid for by their insurance. So at least they're willing to try them. And they've been working great for our complicated diabetic patients. So anodyne shoes are a real good option.
Mark, I'm going to apologize because I can't hear you. I saw you talking and I don't know if it's something wrong with my sound. I know you're on.
Anybody else? Can anybody else hear me?
Mark, I can hear you. This is Kristen. I can hear you.
Thank you.
I can hear you fine. This is Dr. D.
Okay, everyone else can hear you. I just can't. I don't know what's going on here.
Okay. Well, thanks, Angie. I'll write it in the chat.
I'm sure what you said was fantastic. Oh, technology. Oh, good. Plug for interventions. Great.
Because the other thing.
All right,
I'll
well,
add-
if anyone else wants to talk and I can't hear you, that's fine too. Feel free to unmute.
The other thing I would say, Angie, I don't know if you can see me talking, but I'm talking. If you talk to your local running shoe stores, they'll give you these notepads. I use them all the time. You can write on there details about what kind of shoes you want. And if you leave them in the box and have the patient come in, you can trial them. And most of these high quality running shoe stores will take the shoes back. So you're not out anything by doing a trial of a shoe that's either too much or not enough correction or the wrong size. And then having them go back to the store and try a different size or go from a guided shoe to a motion control shoe. So just another thought. I do that routinely with my patients when I'm recommending shoes.
Mark, may I ask a question?
Of course.
I wonder if the notice of this with the Zoom could be sent to like Nicole or Dr. Friedlander or the chief residents. I don't know what the residents are doing on Thursday noons, but this kind of thing would sure be helpful for them.
Yeah, I can take care of that. It's no problem.
Thank you so much.
You're welcome. Thanks, Dr. D.
Yep.
Thank you, everyone, for attending. We will get this recording onto our website with our the rest of our prior Tanqueray Lunch and Learns. And next time we will have a talk from our prosthetist Mary Reedy on prosthetic hygiene. So that is the second Thursday of June, which will be June 9th, and we hope to see you then. Thank you.